Hey guys, how's it going? Anybody want to do a medical coding practice exam question? Hey guys, how's it going? How's it going? Good to see you guys. Anybody want to do a practice exam question? Hey Great Value, how's it going? We got two answers with the same CPT code. I'd look at those really quickly. Let's see. Good job. You did do it, Amy. Good job. Perfect. Here's the next one. We got two of them in the 60s, the 00860 and 64. I'd look at those two codes first, see what their differences are, and then see if they match the question. No worries, Great Value. Hey Mary, how's it going? Good to see you. I've been working away today on the website. I added a bunch of new questions to the anesthesia. I'm almost ready to release that section of practice exam questions. And that's why I have these questions up. Just playing around with them, seeing if there's any kind of subject matter that I forgot to add questions about, if I've covered everything. I think we're good. I think we're good. I just have some PDF documents I gotta upload. I did add a ton of new E&M questions to the E&M page for people to practice with yesterday, and a new one up on the YouTube channel. This one is A. Good job. Perfect. Next one. We've got two of them in the 60s. So the 00, 160, and 64. I'd look at those two first and then see if we're in the right area. If you haven't yet, be sure and hit the follow. I do like to teach for free here on TikTok and on YouTube. So if you haven't followed yet, be sure and do that so you'll get notified when I do go live. Mondays and Wednesdays are my TikTok live days, and Tuesdays and Thursdays after work are my YouTube days. If you have any questions at all about medical coding, I'm here to help. Yay, Meek. Awesome. Did you get it from hopefully Amazon or maybe a store called Book Run? Anything that's got free shipping and it's the cheapest possible that you can find right now. Hopefully you didn't get it from like AAPC where they're charging $20 a book to ship it, but you know. Oops. CPT. I do have some ladies in my Discord study group. It's a free study group that are selling their books, and that way there's no seller fees or anything like that. You guys can just make your own deal offline. Might be cheaper. You can use a 2023 CPT book if you're taking an AAPC exam in 2024. That might be a cheaper option. Barnes & Noble, oh no, that one's wrong year, wrong year. There's a place called, ooh, no. Wrong year. Don't know why. The cover looks the same exact as 2021, so gotta be careful. What do you guys think the answer is for this one? C? CCA. I believe you guys' exam, good job guys, will no longer accept 2023 CPT books as of May 1st. I believe you guys have to have updated books. CCS and CCA are from AHIMA, and they change their exam and expect exam takers to have updated books every May 1st. But AAPC allows you to use prior year books with the understanding that you may encounter some information on the exam that is not inside that manual. But I happen to have a document that will turn your 2023 CPT book or ICD-10 book into a 2024 if you want it. Can speed reading make us any faster? Learning what key terms to look for inside each exam question is better than speed reading. Being able to do word searches is a very good technique to use. knowing to look for things like cervical, thoracic, lumbar, the different hernias, ventral, incisional, looking for key terms like middle, external, or inner, intra, extra, trans, proximal, middle, distal, lower, anterior, posterior, upper, lateral, medial. Those things are more helpful. Being a very good word searcher, that's a good skill to have. It's not about reading fast, it's grabbing those key terms that you need because of the differences between the CPT codes. Closed, open, xeno, allo, cadaver, living, superficial, deep, diagnostic, therapeutic, initial, complex, subsequent, qualitative, quantitative, trans, supra, infra, intra, extra. Those are cool. Looking for key terms that mean skin, bone, or muscle, because there's different, like tres minor is a muscle. Those kind of words are what's good and key. This one you think's D? Good job. Very good, Court. What about this one? Are we going to need that qualifying circumstance code, the 99100, or do we need our P2, which is another qualifying code? You were wondering if you should start with CRC or CPC. Ooh, CPC is a lot. It really is. If you start out with CRC, number one, when you get that certificate, you're not an apprentice. You are a real certified coder and you have a CRC, which is a highly sought after position in medical groups right now. And it's only over the ICD-10 book. You only have one manual to learn. Then you could go for your CPC and learn your CPT codes. I think CRC is a great way to go first, actually. Plus, if you could get a job while you're a CRC and getting your CPC, you'll already have your experience in to get rid of your apprenticeship. My children are walking in. Hold on.
I've got a headache. I think I'm going to lay down.
It's 6 p.m. on a Sunday night. Okay, but Travis ain't coming out to the living room. Why don't you just lay down on the couch and watch Dune? That way he stays in his room. I'm doing a live, baby. Sorry. Negotiating with demons is very hard to do. He's wanting to go to bed at 6 p.m. on a Sunday night. This is my old man, my 15-year-old. And then my other 15-year-old is in the bedroom that they share, dancing his butt off on the Oculus, doing monkey tag, whatever that is. Yeah. Anyway. I got my CPT. Good. I have to start prepping and about to get the ICD-10 and the hip picks. Awesome, Mary. Thanks for sharing the live, Nicole. Claudia, thank you for the rose. I'm sorry I didn't notice that. I love beauty. Love the smiley faces at me. That's why you live live are so late with me. It's 9 p.m. No way. It's only 6 here. The sun is still out here. It's crazy. Everybody thinks it's C. Good job. Perfect. What about the guidelines for emergency anesthesia? That's crazy. I'm 3 hours behind you. Another D on a different question. I'm doing something different. Get that to run while I'm back over here with you guys. You said that all wrong. Oh, no worries. No worries. Can you please do a study guide for CCA? Yeah. Where do I get prep information for my CPT book? Meek. Meek is asking. Well, the first thing you do is... Sorry, I'm going to bust this in here. Let me see. Here on this. And we're going to go to here. We're going to go here to medicalcodingbyjen.com. It's my website. It's totally free for you guys. And if you go to the resources tab and you hit the CPT book prep page, I've got 8 pictures here. All you do is click on the picture and do what I say. No big deal. And that'll get your book prep and the CPT going. It'll also get you going on your anatomy pictures to update in your CPT book. And then when you get done with that, I've got 3 pictures to tell you what to do in your ICD-10 book. So all free for you guys. Of course, there's other things underneath the resources. Be sure and stop by the FAQ page because that'll show you how to get into my free study group. And I have the 3rd sentence down is where is the best free resources. This is where you can find a ton of free help, even free classes from CMS that you can do. There's one on their educational site about ICD-10 training right now. There's a free scholarship and a free grant, tons of other free practice questions, all that stuff here on my website, including the book prep videos where you can watch me book prep the CPT book is here too. The practice area where you can practice exam questions, the blog. I have a 9-chapter book I released yesterday just on the 3 elements of MDM that are right here. If you want to scroll through that, it's not too bad, but it is 9 chapters. But it tells you how to do the 3 elements of MDM. This is the same thing except for in a condensed version, and it has practice exam questions. If you're looking for getting a job, there's job postings and stuff like that in the blog. It's all free for you guys. There's a free practice area where you can practice exam questions. Just click on the answer and it tells you the rationale. I do have a membership area if you want to do bonus practice exam questions. It's here, like this is the E&M one. It'll come with a bunch of extra PDFs that you can download here on the side, but I've got practice exam questions for days. There's a ton of them here, and that's just E&M. And then I have another page for integumentary and cardiovascular, and they all come with PDFs and stuff to download. The shared gallery is super helpful too, but that's where you can go for your book prep stuff. And we can continue practicing some exam questions. What did you guys think is the answer for this guideline question? Are we serious? Are we delay? You're welcome. How do you become a medical coder? You grab you a 2024 AMA CPT book. Let me see if I can't get that to work. I'm trying to get my camera to work. There we go. This is what the book looks like. It's from AMA. They're the only people that make it. You're looking for a 2024 CPT book. Just do a Google search for it and then switch your search to shopping, and then find somebody selling one, the cheapest with free shipping that you can. Start out with this book, then you go to my website, medicalcodingbyjen.com, go to the resources tab, go to the CPT book page, and it will show you step by step how to turn your book into something like what I've done to mine. Step by step, so that you can have it all prepped and ready for your medical coding exam. The main thing is if your codes start off with the same wording, like you have 2 implants, or right here we've got 2 craniotomies. These 2 codes are both craniotomies. That's words that they start out with. Well, what's your difference? This one, we're doing a craniotomy because of a tumor. This one, we're doing a craniotomy because there's something wrong with this brain stem. So writing those differences down and putting it right underneath the code will help you out a whole bunch, because during the exam, all you got to do is multiple choice practice exam questions like what we're doing right now. And if you go to the answers first and you know what to look for in the question, am I working on a skull? Am I working on an abscess? Am I working on the meninges? Or am I doing a tumor removal? All you do is search your question, and if you did do a tumor removal, you know your answer is that first number. Even without knowing much about going on, in medical coding, the way we prep this book is super helpful, because that way, even if you don't know what's going on, you know if you're doing an abscess or a tumor, because the question will tell you, right? So if you got our 1-word difference down, you're good to go. You can pick out the right answer. And all you need is this one exam to pass for medical coding. If you get your certification from AAPC or from AHIMA, either one, and as long as you pass that one exam, you're certified and you are able to get a job in the medical field. No, you don't have to go to school. Absolutely not. Do not do that. I didn't. Not for medical coding. I have not used Cengage for practice test. I don't know, can you go there and buy medical coding practice exam questions without a course through them? I was having trouble finding that. If that's true, I'd love to find them and look at those practice exam questions and see how well they are made. But I have not been able to find them without buying a course. So let me know if that's true, if I can do that somewhere. I'd love to purchase them and practice them. I purchase everything. I've purchased all of AAPC's courses, all of their study guides, all of their practice exam questions from every certification. I've purchased everything online from many, many, many different people that sell practice exam questions, and I've tested them all. I still prefer only like CCO, AAPC, and Pocket Prep so far. Keeping an up-to-date, current with the guidelines set of questions is extremely difficult. And I'm trying to do that on my own website for you guys, and it still is a lot of work, especially for one person. But some of these companies have things put out, especially on Amazon. Don't buy anything from Amazon with practice exam questions in it, that are advertising that they're up to date with 2024 practice questions, like 400 or 800, but they're using codes that we haven't used in 10 years. They're just not up to date, and the guidelines and the questions are outdated guidelines too. On top of it, it's really bad. Thank you. Thank you, Shauna, about my notes. I can teach CRC, absolutely. My next workshop is going to be including some CRC practice exam questions with CPMA and CPC. That's going to be on May 5th on Sunday. We're going to do 3 hours. Y'all are saying A or D? Which one on this one? No, you can self-study. If someone has a bachelor's in HIM, which coding certificate would you suggest to pursue? CRC, Mariah. Absolutely CRC. And then probably a CPMA. If you had those with your bachelor's in HIM, ooh, you could be running something in some hospital somewhere. Wear them high heels to work if you felt like it, or work remotely from home. Do not go to school. Listen to Jen. Thanks, Island Mountain Girl. It has been a while. I like seeing you again. I'm so glad you're here. Three weeks left, and they don't even help with the exam. Correct. The courses do not help with the exam. It was C. C is the answer. When delay of treatment, you know you wanted an answer that's going to have delay in it, because 2 of these answers both started out with when delay. So you know your answer is either going to be B or C, number 1. Then you just need to look at your difference. Would lead to significant increase in life-threatening, or should be acted on immediately. That's not really good medical terminology in B, so that tells you that C is the answer. All right, what do you guys think about this one? I'm so glad you're back. Are you going to take another certificate? CCA is starting to fade away because the exam is not geared towards an overall medical coding certification, and I think AAPC is doing a better job advertising than AHIMA is with their CCA. So I think it's just an advertising thing to employers, and because CPC can do surgical stuff, hospital stuff, and doctor office stuff, it's kind of a stronger certificate, but the CCS is a lot stronger with more hospital coding than the CPC is. So I don't recommend getting your CCA. I really prefer you to go on and get a CCS or an AAPC certificate like CPC or CRC, because there's just not a lot of job market out there for just a plain CCA anymore. If you do end up and you've already paid for it and you're already going for it, get your CA, great, go on and get it and try to pass your exam. But you're going to have to get another certificate. And I would recommend, if you can, come on over and do your CRC or CPMA with AAPC. Yeah, I'm sorry, Kelly. It could be worse. You could be doing the NHA certificate and course, and absolutely no one will hire you with that particular certificate. But you can find jobs with the CCA. You're still not underwater. You're going to be okay. Thanks for the follow, Maria. Shauna, thanks for the heart me. Stars, thanks for the friendship bracelets. You guys are great. I take that TikTok money and turn it into YouTube subscriptions for everybody. So if you come in on my lives on YouTube, I have exclusive videos that do a lot more book prep and workshop videos and stuff. And I give away those free workshops and exclusive content with my TikTok money. So we'll be live on YouTube on Tuesday and Thursday this week, and we'll give away more YouTube subscriptions. How do you start studying for your CRC? Well, you're just going to have to go find you a whole bunch of ICD-10 practice exam questions. And the good thing is, if you do purchase Pocket Prep, you can build your own exams in Pocket Prep that will only do just all ICD-10 questions. Also, if you get the study guide from AAPC for CRC, it will come with a lot of practice exam questions. And I really like this book. It's from AMA. It's Risk Adjustment and Documentation Coding. Whoever this lady is that wrote this book, Lord, she's good. It has multiple choice practice exam questions at the end of each chapter. And you have clinical examples, more than I could even get through. I tried, but it's really good. Like, she gives you an example of how you do probable pneumonia with COPD and what the risk adjustment would be in small little examples, which I really like, because I don't like reading a ton when I'm doing stuff. Just give me the example and let me move on. But this book has so much in it, a lot of examples, but I really like each end of chapter multiple choice practice exam questions, because it seems like those are very, very similar, if not might be some of the questions on the CRC exam. I haven't taken the CRC exam. I'm working my way through all of them to take all of them. I've done CEMC, I've done CPMA and CPC. I'm working my way through them all, but haven't done them all yet, so that I know what's on the exam so I can help you guys out more. But I really like this book. It's a good one. But it's expensive. It's $100. But it's a good book. You should be able to do this with just your ICD-10 book, your CRC study guide, and the practice exam questions that out of AAPC. Don't buy a course unless they give you the course for free. Sometimes they give the course away if you just buy the exam attempt, but I don't know if they've ever done that with CRC. But this book is really good. I wish I'd gotten it in an electronic format, because it makes for writing the questions out for you guys harder when I got to type it all out. So I should have got an electronic version, but I wasn't sure how good this was. But it really is a good book. and it'll teach you more than you want to know about risk adjusting, for sure. It's a good book. Which ICD-10 book? You really need to get the AAPC version of the ICD-10 book. If you're going to take an AAPC certification, you need their books. They have decision trees and stuff inside their books that they test you on, that if you don't have their version of the book, then you're missing out on what they're talking about, or their tips that they put in on these books. So I really do recommend you get an AAPC version. Now, you don't have to buy it from them. You can absolutely go on Google or from any of my students that are selling theirs, and you can purchase one used, absolutely. But you really should get their version of it because it makes a difference. They have a lot of pictures and mostly those decision trees that are super helpful, and I love the differences between each code is highlighted in green. That makes, boy, if the CPT book was done that way, half of our book prep would be already done, for sure. Super helpful. But we definitely need to move any guidelines to the ICD-10 book, especially when you're going through and doing the external causes. So when you go through the index in the front, you've got an index just for external causes. Make sure you've got your 5 different sequencing labeled, and then you color code each color for whatever is going on, like place of service will always be yellow. Those kind of things is super helpful. And you move the guidelines to the codes that it affects, and any coding examples that they have as exam questions. When you're doing craniostenosis and it's unspecified, it's going to be that code. When you're doing it and it's unilateral, it'll be that one. Something like that is super helpful, especially when a disease is not called something like it's a syndrome, and you code it. Let's see, what's 4479? Where's that one? When you code something and it's under like other congenital, but that's the one that you use for a particular syndrome, that is super helpful, especially when the name of the syndrome is not inside your ICD-10 code. That can be super stressful. It looks like this is a 2023 book that I turned into a 2024 book by adding in the new codes, is what I've got going on in this particular book right here. I think that's what I did to this one. It doesn't have the clinical examples, but it's got the new codes in it for 2024. That's why. So I need to find, oh, boy, I got a ton of their books. So I moved all the cancer guidelines to that page. And then when you start chapter 2 for ICD-10, the neoplasms, I've got all the examples that I could possibly want, like how you do anemia with cancer, how you do radiation. They're here for radiation today. No, they're here for dehydration in cancer. It's all on this one page. That way I don't have to go down to the individual codes for those situations and find them in the middle of the C-section book. They're all placed right here on the very first page of cancers. This is how I deal with cancer with dehydration, or I'm due with anemia, or if they're here for chemo or radiation or immunotherapy, what code is first. If they're here for anemia due to a malignancy, what goes first? All of it's just right here. That way I know what my situation is by just going to page 1 of the cancer. I do the same thing for like hypertension. If we go to our E11, now you know I'm going to have pregnant patients that have hypertension, gestational diabetes. Instead of doing it all in the back of the book where the OB codes are, I also wrote them all right here near my E11. That way I've got every example of hypertension that I could possibly be asked on a question right here on these 2 pages. Whether they're pregnant, whether they overdosed or underdosed on their diabetes meds or whatever. It's all here on these 2 pages. But if we do go back to my pregnancy, my O24s, it's all rewritten again there too. It helps reinforce norms. I've written it twice, so if I see something during an exam where codes are switched around and they don't look in the correct order, I know I've written them out twice, and it just makes you realize some patterns too with this kind of stuff. Anything like that is a guideline, there's my pregnancy ones, that is in the front of the book with all of our ICD-10 lovely nightmare guidelines in the front of the book. Instead of leaving it there, I move it to the codes that it affects. So when they're talking about a particular guideline like burns or fractures, I highlight it, of course, up in the front of the book, but I also move that guideline to the actual real codes. I'm trying to find one real quick to show you. So like with burns, it's always you code the 3rd degree burns first, and then the 2nd degree burns, and then the 1st degree burns. I just moved all those guidelines back here to the particular codes. Also, if I have an example that has multiple codes in it, let's see, this is a patient who's a victim of a drive-by shooting. He was shot twice in the left bicep and abdomen, ended up sustaining a laceration to the small intestines. We started out with the code in the S36s, and then we ended up with another one in the S41s. I start this example right here with the first code, the S36, but if I go to the S41, I'll have that example written in the same color ink as the example that I wrote right here, and I'll put example on page whatever, that's the page that this is on, and I'll underline my 2nd code, 3rd code, 4th code, whatever. I'll go through the whole sequence. There could have been 5 or 6 diagnosis codes, but they all get underlined and they all get told where the original example is. This again just helps me notice patterns. I did 2 S codes for this particular patient. Some other examples will not have multiple S codes. But I have a ton of notes for ICD-10 if anybody wants to just copy them page by page, but it's super helpful to move any of those guidelines to the actual section. I was trying to find something else that might be helpful for CRC. The Chapter 20 codes are never coded first. Another guideline from the front of the book that I moved back here. And then we've got our 5 areas that have to go in particular order. Super helpful. Got all the COVID darn guidelines and examples all on that page. That's the Chapter 22 COVID diagnosis codes. Many people can't even find these because they're after the Z codes because they ran out of space or something and just forgot to put the U's in there. But even just finding the codes sometimes is really difficult, much less marking them up. I've got all the HIVs done up. If they're here for a visit for HIV symptoms, you got to know what order to put it in. If they're here for testing with no symptoms, you got to know what order to put it in. All those kinds of different examples. Burns, you got to know in a particular order. Anemias, you got to know in a particular order. Pain has a lot of them too. Adverse reactions, poisonings, toxic effect, and underdosing. All those things you got to have in a particular order and know their guideline that goes along with them. So that's super helpful. If an MD writes your prescription and you have an allergic reaction to it, it's done in one particular order. But if you do it to yourself by taking your Aunt Sally Sue's penicillin, thinking it's going to fix you, then the order set goes in a different set of order. It changes. So having that at the chapter headings of where it's affected, this is chapter 18. I have my main headers here and my examples all on the very first page, even though these codes are in the T's, and some of the symptoms could range from fever to not breathing. It could be anywhere in this symptom book, but I just put it all on the chapter header page. That way it's easier. CKD, all the different guidelines that have to deal with the kidney issues. Put all those onto one page with the diabetes. Super helpful. Oh, sorry, knocked off the camera. But tons and tons and tons. It is 6:41 here. Thanks for the follow, Kathleen. That was my granny's name. Sydney. Trendsetter, good to see you. Kelly, thanks for subscribing. You're awesome. Sorry, I was looking at my book. I haven't even looked up for a while. Stars, thank you for the friendship bracelets. Shauna for the heart me. Claudia for the roses. Trendsetter for the heart me too. Martha, I hope I can help you out. Do you recommend taking the exam at home? I live hours away from the closest testing center. I do, Mickey. I take mine from home all the time. I've taken them in person too. I like to take the exams twice so that I see the exams twice for you guys. The first time I took it, of course, I wasn't thinking about teaching. I was just doing it for myself during COVID, and I took it right away. Before I studied or bought a book, I wanted to take the exam so I knew exactly what to study, and that's why I picked AAPC, because they give you 2 exam attempts. So I went right away in person because the online version, they did not allow for you to make highlights in your books, but if you went in person, you could make highlights. So I went in person with my highlighter and I just highlighted all the codes that were on the exam, took that at home, and then I audited that. Why did they pick these sets of codes versus the rest of the set of codes in that chapter? There has to be something different about those codes. Was it a parenthetical? Was it a guideline? What was it? Why did they pick those? And that gave me direct insight on what to study, because I didn't want to learn medical coding. I don't need it for my job. I just wanted the thing to say that I was certified, so that when people ask me at medical conventions, are you a CPC, I could just say yes, instead of explaining how no, I'm not. I'm a medical auditor, but I don't need to be a CPC. I'm this, that, and that thing. It just creates a whole conversation that I didn't want to have anymore. And I thought, well, while COVID's going on, my audits are down, I got plenty of time. I could learn enough about this just to pass. So that's how I attacked it. And then when I took my CPMA the first time, I wanted to take it twice, so I wanted to make sure I failed. But I took it in person the first time in December because we were in Vegas with my eldest and we were riding scooters around town. I thought it'd be a great time to do that, so I went in there and did that. But then when I took it in January, I took it remotely from home, and it was still 100 questions, and I did it in 2 hours and 5 minutes. Just super fast. That way I only stuck around the questions for 1 whole minute and then moved on to my next question. I like doing the questions where I don't read them at all. I just look at the answers. I look for coding irregularities or things that should not be in a certain pattern, or look for my one coding outlier, like this P1 versus all the P4s. We've got our AAA, you know. There's always something going on that should be here or shouldn't be here that can lead you to the answer really, really quickly. You know, if the anesthesiologist did this himself, that we got to have that AA, so you can eliminate that one. If our patient's of a certain age, we might need that qualifying circumstance if age is not inside the CPT code descriptor. Everybody saying it C? Good job. What about this one? Dislocation of the wrist. We've got the 10 and the 20 that are the closest together. I just go see what my differences are, what my one-word difference is that I have written in my book already, and then search my question for that one-word difference, and then pick my answer and move on. No worries, EJ. But if you take it at a testing center and the power goes out, the exam fails, something happens, you get a retake. If you take it at home and lightning strikes, your internet provider decides to do a refresh, whatever, and you lose internet during your exam, you lose your exam attempt. There's no retake-sies on that. So there is a risk, and it is stressful. I've had them climb the walls in my house to change out light bulbs when I didn't have, a light bulb in this room to switch it out with. I've had them move my camera 15,000 times. I've had them put my hair up out of my face. They don't want anything near your jawline. And I'm not a ponytail holder person. I'm not a clip holder. I'm not even a hat wearer. So it is stressful just to get into the exam and get it going when you're at home. If you take it at a testing center, they have the equipment and it's already set up the way it should be. You can just get in and log on to your exam. So it's a little less stressful, but I've worked remote from home since 2013 and that December, and I'm pretty tech savvy and still have had troubles where my exam stopped and my internet had to be rebooted and then I had to log back on. Luckily, the exam had not started yet, and my proctor had given me a link to get back into them with the Zoom meeting as soon as I rebooted my computer. And anyway, it worked out, but good Lord, even being tech savvy, there's going to be issues, and it is stressful. And it's really rough to start your exam under stress, but once you get going, you're going, and it's okay. I'll tell you, the AAPC site has a wonderful video where they've painstakingly gone through each component of what you will expect when you go online to take your exam, what the proctor's going to say to you, what your screen is going to look like. So if you go, well, that's my website. Let me see if I can't go here. If you actually go to the AAPC site and go to certifications and then live remote proctor testing exam right here, they have this video right here. And if you go through all the tiny little steps right here, it will show you exactly
you will receive a
what
confirmation
the exam
from at aapc.com
is going to look like, and then even what it's going to look like when you're logged on.
Read through the question type, show this page
blah, blah, blah.
versus that can be used during
and
the
examples
exam,
of the
depending on what
exam,
sections
but
you
they
are
also show you
the pencil icon at the. We recommend using
what the proctor will ask you for and what it will look like when you are logged on with the proctor. Even how your video camera should be. There's all these things right here. It's really cool what they do show you.
Click up to start your webcam video.
See?
For the session
and
to
then you'll
proceed,
be able to see
select
what the
Start My
screen
Video.
looks like for you, and
Next,
then what it
share
should
your
look like
screen.
for the proctor.
This can be done by clicking the Share Screen icon at the bottom of the window. Select the desktop
Your
view,
computer with
then select
them.
Share. Most of the proctors
We'll
Hi,
speak.
my name is Chansey and I will be your proctor today. Please confirm your name is Wendy and you're about to take a
And then they
CPC
even show you how to show your
certification part
driver's license to the
politely
proctor.
to repeat the set your schedule
And
exam
just
sent to you
a
previously.
ton of info here.
It is very important that you review
And
those
then if you go to a
instructions
testing
prior to
center, they
connecting
have a
with the
whole set of
proctor.
new videos
The
for
allowed
that,
materials will vary.
and what it will look like when you go to the testing center, and then how to schedule the exam at the testing center. So they've if you want to know what all the steps are, they're right here on the AAPC site. So pretty cool, pretty cool. Let me get rid of that. There we go. Did anybody get an answer for this particular question on anesthesia? We're almost done with anesthesia. We only got one more left. You can take it remotely from home if you want to, or you can go to a testing center and use their equipment at the testing center to take a remote exam. The exam is always remote, if that makes any sense. Good job. It's just whether you want to use your own internet and computer setup, or if you want to use a testing center's computer and setup. There is safety in doing that. After passing the CPC exam, can you work from home right away, or do you need to work for a year in person? You can work right at home right away. You just got to find the job. I would recommend HEDIS chart extraction every October through March of every year. Every single patient's chart has to be audited, whether it's the health plan or your doctor's office. There's a lot of remote jobs. If you can just navigate an EHR system, and you can work with CSI or some other company, going through patients' charts, looking for pap smears, mammograms, and things like that. If you're really good at problem solving and finding patients that have their date of birth is inverted, instead of it being March, it's under a September, the 9. Somebody 10-keyed it in wrong. Or some people, their first name is Johnson, but their last name is Marshall. Well, they've reversed the name, and Marshall has his medical records say his first name is Marshall when that's his last name. You find his colonoscopy in a wrong chart. That's what you'd be doing. And if you can stay and do that for a year or a season, then you can definitely get any medical coding job that you want after you get your year in working totally remote with them. Another C. Good job, guys. All right. What kind of quiz do you guys want to do? Do you want to do guidelines or all E&M questions or compliance or regulatory? We could do cases, but they really don't show up like really good on this TikTok because they're usually multiple screens. We could do terminology, diagnosis codes for you CRC people, E&M and guidelines, E&M and guidelines. All right. Guidelines, E&M. Okay. I got those two things. They've got 91 questions that are either guideline or E&M related. Here's your first one. Go look up your headers first. If you're doing E&M, we don't do the process of elimination. What's your header for 99203? It's new patient, low. 99242, consultation, office. 99243, office, consultation. 99252, that's a hospital, consultation. Okay, if my answer was A, the patient would be in the hospital. If it's B or C, the patient is at another doctor's office, was referred by their primary care physician, and they're getting a consultation. If it's D, then a patient is here to see somebody and they've never seen them before. What's my patient status? Where are they? How'd they get there? And what header would I be under? Hey MK, my love, I miss you. How are you doing? My mom is doing fantastic. How is your mom doing? My mom is up without a walker. She's down to physical therapy 1 day a week, and she can walk without a cane even if she wanted to. She's doing really fantastic. My mom just had a hip replacement end of March, and it's only the end of April. She's doing great. What'd y'all do? Specialist comes to the specialist into the office for a hypothyroid consult. 30 minutes. Straightforward exam. So the way that AAPC would have written this question, if this would have been truly the answer, you would have seen one more sentence in the question where it would have said that the endocrinologist wrote a letter back to the PCP noting their recommendations. You would have at least seen something along those lines. And when you don't see something like that, saying there's a note going back to the PCP, then you know to bill D, which is a new patient. But the way that Pocket Prep wrote this, they inferred that the patient was there for a true consult, which was referred by their PCP, and they inferred that a note would go back to the primary care physician based off these 6-7 words that they wrote here. Just know that during a real CPC exam, no one gets a consult. Everybody's a new patient. Because you got to see that that letter is going back to the PCP. But, you know, these are bonus practice questions. What about this one? This looks like a guideline one, and it looks like a very good anesthesia one. Ooh, I like this one. I don't think I have one like this one. I like that one. If I missed your question, please just ask it again, because I can't keep up with chat sometimes. Trendsetter, thank you for the friendship bracelets, girl. Kelly subscribing. Star, friendship bracelet too. Shauna, Heart Me, Claudia, Roses. Trendsetter just popping out with the bracelets. Necklaces, that's what they also are. Chic, thanks for the follow. How's MK's mom doing? I hope she's okay. Ulcer and then, aww. I can't explain modifiers. Modifiers are only supposed to be used if you are changing your CPT code descriptor. So if your CPT code descriptor is for a fracture of a tibia, and that's all it says, you know you need to indicate your laterality, right? So you have to do right or left or bilateral, you know? So that's the only thing we're changing of that CPT code descriptor is the laterality, right? Because you got two of them. I'm so glad you came across me too. Hey, Queen Bey. She's still in there for 1 month. My mom was in there for a week for her hip fracture. Well, from Monday till Saturday, and that was the longest for any hip thing. But we couldn't get a surgeon to fix her hip till Thursday. But oh my gosh, I can't believe she's been in there that long. Oh, I'm so sorry. I know you miss her. You've got to be exhausted going back and forth, too. I was, gone 15 hours a day, driving to the hospital, staying with her all day, meeting with all the physicians, team care, setting up all the stuff for when she needed to get home, and then coming home, not to see my kids, just to shower and change and go back. Can't believe it. They did an EGD twice, then she bleeds, of course, more when they do those tests. Yep. Oh, Sylvie, thanks for the follow. And it's so far, and she's far. Oh, my mom's hospital was an hour away too. What do you guys think is the answer? We got A's and C's. Patient has a mild systemic disease. Is that a P1 or a P2? Then we can decide a resident physician. What modifier do we need for that? Did you move all your HCPCS modifiers to your CPT anesthesia section? Because if you didn't, then you're going to have to go look in the HCPCS book. Good job. It is. Perfect. Don't be reading the question. If you're reading the question already, you're doing it wrong. Go to the E&M codes. What are their headers? What's the differences? We've got 2 of them that are 993 and 2 of them that are 994. When the third digit is different, it usually means there's a header differences. What's the header differences? New or established, right? So go find out if your patient is new or established. That will help you eliminate 2 answers right away. Then just look at the differences between the codes that are left, and then look for the one thing that you need out of that question so you can find the answer. That will save you from having to read 50 words and then moving to the next question where you read another 50 words. You will get brain fatigue if you try to read 100 questions because you're carrying the 50 words from question 1 and question 2, question 3 with you every time you go do another question. This question can be done by reading 2 words and carrying 2 words with you to the next question instead of all 50 is how you get through this medical coding exam. Kimberly, thanks for the follow. Where would I start? I like doing anesthesia first because it's one of the smallest chapters. It seems like I always end up doing it first every year. It's a good place to start. I start by going through my entire CPT book and underlining all the red do not parentheticals that I can find underneath each code, and then I go through and find all the parentheticals that say for bilateral code this one twice or add this modifier, whatever it is. And then I go through and underline all the ones that say use this code with that code, and they each get a different color code. Like the modifier alerts get blue, the reds are for the do nots, and then the green is for the use this code with that code. Then I mark up all my eaches for every single CPT code that has the word each in it. I look to see if it's going to be a multiply times or if it's to write the number twice and add the 59 modifier and add those notes into the book. And then I highlight what's in the parentheses or brackets inside each CPT code if there's something in there. Some codes don't have anything. And then I mark all my opened and closed and percutaneous procedures throughout the book. I mark all the atrial, aorta, artery codes by circling those in red. And then anything that's vein, ventricular, or venous are circled in blue. And then the fun really starts with all the medial, lateral, trans, supra, intra, extras, color coding, all the different allografts, autografts, muscle, bone, skin, all that stuff. Ooh. Qualitative, quantitative. What'd you guys come up with as an answer? I got C's and D's. The last question was A. The GC for the resident physician. It was C. I didn't look up the codes. Molly, nurse, thanks for the follow. We can get the nursey into CRC too. She can get off the floor. These are all age-based codes. So if your patient is of a certain age, they can or cannot be coded in some of these areas. So that's helpful to know. Remember, don't read the question, go straight to the codes. Look at those differences. Richardson, thank you for the heart me. We got 16 subscribers now. Aw. What did I say about the hip picks to the CPT book? Oh, let me show you. So your hip picks book is somewhere. Where is that sucker? Has anesthesia modifiers in it. All these. You need to move these to the anesthesia section of your CPT book for your exam. And a really good place to put them is right here. Start with AA, AD, work your way all the way down and put them right there. That way you will end up with a lovely little list full of anesthesia modifiers. And I've got the list of anesthesias, the different list of anesthesias, but they're all here on this page with all your anesthesia codes. That way you don't have to open up another book and go find those during your exam. Super easy. I have them in my notes if you just want to copy them down, but you can do it during your hip picks book. Some books don't have them all in one location like AAPC does. You may have to go find them in the modifier list. It just depends on what version of the hip picks book that you've got, but they'll say that they're for anesthesia, and you just need to move those to the anesthesia section. I like AAPC's version of the hip picks book. It's got almost 800 pages in it. It's got a lot of info in it. Even has coding guidelines in it and stuff. What do you guys think is the answer for this one? It's not hard at all. I teach from the certification exam point of view. I can teach you how to pass the exam without knowing a thing about medical coding. That's the way I did it, because I didn't need to have the CPC for my job. And I didn't want to learn coding. There's no course or anything required. You just got to pass one little old exam. And there's a lot you can do with it. You don't have to do medical coding. You can work with the Congress, and you can write guidelines for a lot of this stuff. You can work with an EHR company and help them develop a really cool EHR system that uses CPT codes to capture for HEDIS or whatever measurements. And all you're doing is making sure the code that they have programmed to populate when a certain act happens populates correctly with the correct description. You can do prior authorizations, you can do denials, you can do grievances, you can do reimbursements for health insurances and nonprofits. You can do paper trails for transplants or surgeries that you're passionate about. Like if you have somebody in your family that's ever had a heart transplant and you want to give back to that community, you could be one of the coordinators. You know, I don't know. There's a lot you could do with this stuff. Aw, thanks, Abby. Alyssa, thanks for the follow. Dot, thanks for the follow. This is what I'm trying to do in California, but I can't find a school that includes the certificate. Well, you don't need a school. I work out of California, and all you need to do is pass the certification exam from AAPC. And if you take the CRC, I know for a fact you can get a job in California doing CRC. I've worked remote for, I've worked in California's healthcare system since 9/11, so it's been a long time. Gosh, my oldest kid is now 33. He was in the 4th grade when I started working in California healthcare system. And you don't need a school. Don't waste your time. Anybody got an answer on this one yet? You guys know what answer? I says B. B is correct. Good job. What about this one? In both CPT and HCPCS, what does the red dot next to the code represent? Is it previous year, sedation, another previous year, or that year? We've got 2 that end in the wording previous year. I take a good gander at that. You need the next step. Well, all you need to get started, if you're going to do CRC from AAPC, I recommend you getting their ICD-10 book. Just do a Google search for ICD-10 AAPC. Get their version of the 2024 book shipped to you as fast as possible, you know, with cheap shipping. And then you start, if you want to do CRC, you start with the very first pages, which are your medical coding guidelines. And all you got to do is highlight and find examples of whatever they're talking about right here in the set of guidelines in the front of the book. So, let's see, what book do I have? I have 2023. Did I do 2024? 2023 it is. So, I know I've done, that's 2022's. Where's 2024's? Lord, I got too many books around here. Oh, there's 2024. Okay. So just get that first book, and as they're talking about a particular guideline, go find an example in the book, like the guideline for See Also. There is a page, the camera stopped working again because I tapped it, on page 333 of the ICD-10 book that has an example of what the guideline is talking about with a code that says See Also. So then I just made a note of the page number of where it's at, and then if I go to page 333, I'll find it in my index that says there is an example of See Also right there. And then I have an example of what See Also looks like on page 604 in the middle of the book, where the code finally ends up, you know, back here. On this page also, which is super helpful, it's down here on the bottom. And I just make a note and highlight it too, so that I know that this guideline right here that they're talking about, what it looks like inside the real book. And I do that all the way through, all the little pages and all the little guidelines. Like this one's got, which is an exception for the late effect. There's an example on page 699 and 700 for this exception to the late effect issue that's going on. But I've got the notes if you need them, but all you need is their ICD-10 book. You need their practice exam questions for CRC, and then you purchase the exam attempt, and you'll get 2 attempts at taking the exam. And you'll need the study guide that goes along with it. You don't need the course, but the study guide is super helpful because it'll be a little workbook that'll take you step by step on chapter 1, the business of medicine. What do, you know, and how do you do it? And then it'll have practice exam questions in it. And then you'll do chapter 2. And it'll have everything in it that you need to know for CRC or CPC, whatever you want to do. But all you need is an AAPC certification in Cali. And there's no course or exam other than their certification that you need. You can absolutely do it without a course. Earpiece in. You did your CPC yesterday and you passed, Annie? Congratulations. I'm so happy for you too. Fantastic. Was there anything on the exam that you had no idea was going to be there? Oh, she took her COC. Her COC. Is that 2 people? I took my COC last week and you passed. So excited for you because that is so hard. And Annie took her CPC yesterday and she passed. Awesome. Mickey, both CPC and CRC. I recommend both. 2 certifications, you get 10 more thousand a year for just having both. Can't see all of the question. Is it is my thingy too big? Let's see. Make it smaller. Does that help? Can you see it better? Yeah, you pretty much find out within an hour if you passed or not. Annie says she took the practice exams and that prepared her. Congratulations. Yay. Awesome. You're welcome. COC is pretty difficult on those practice exam questions. They get really minute little differences. Knowing what an implants would look like versus screws and plates, because you can use screws even when it's an implant, but then they won't call it an implant, but you'll see them harvest something somewhere else. That's how you know it's going to be an implant. So there's things that they do in those exam questions that are pretty tricky on COC, so excellent job passing that one. D, good job. What about this one? If a procedure or service is performed and it includes a special report from a performing physician, what does that mean? It's usual and customary. The procedure report requires sedation. It means that it's rare, unusual, or it could require multiple modifiers. No, I'm on YouTube and I have my own website. So I teach for free Monday through Thursday, 2 hours each night after work. Mondays and Wednesdays are on TikTok. Tuesdays and Thursdays are on YouTube. And they're just free lives, just like this. And all the replays are available on YouTube. And then I have my own website, medicalcodingbyjen.com, where there's tons of free resources for you guys. Shows you step-by-step book prep. Even for the ICD-10 book. I have blogs, job resources, image gallery. We have a Discord study group. It's been going on for like 3 years. There's like 50 rooms inside my Discord study group. So if you want to know stuff about CPT, you can go into that room. If you want to know something about practice exam questions for CPC, there's a room for that. If you want practice exam questions just for CRC, there's a room for that. There's a room for COC practice exam rooms. There's a room for just hip picks. There's a room for job exams. There's one for job resources. There's one for continuing education. There's one for your pets. We want to see your fur babies. There's all kinds of rooms. So got lots of stuff going on in my Discord study group, and it's all free. Heather, thanks for the follow. C, perfect, good job. Which section of the CPT book uses time as one of the main coding factors? Radiology, anesthesia, medicine, laboratory. Ooh, they should have E&M up here too. Huh. Some of medicine has some E&M codes in it too. But you guys should know the answer to that one. Yep, anesthesia. If we're doing a diagnosis code, a lot of times the 9 is non-specific or the 0 is non-specific, and they want you to be super specific, the right side, left side, unilateral, bilateral. So I'd look really hard at the 7 and 8 first. That's where I'd run to first. What do you guys think the answer is for this one? I recommend a study guide. If you're going to take AHIMA's CCS, then get their workbook. I love their workbook. if you're going to take an AAPC certification, whichever certification you're going to take, they have a workbook that goes with it. It's called a study guide. Get their official study guide. If you can find one used that's older on the internet, I recommend that because it saves some money. But if you have the money, get the new one, of course. But it's expensive. But the study guide, the practice exam questions, and me is all you need. I can get you there. I can get you to pass. Hey, Margaret, thanks for the follow. Thanks for sharing the live and tapping, guys. We got 2,000 views. B, is it the 0 this time? It is. Awesome. Good job. More modifiers. These modifiers are found in the HCPCS book, and I do not know them. They don't look like they're anesthesia ones. But we've got 2 that start out with a T and 2 that start out with an S. Which of these HCPCS code can be used with CPTs? What do you guys think? T1? Yeah, I don't know the SL, SB, or TP, but T1, is that for a finger or toe or something? Yeah, probably. There we go, good job. Remember, don't read the question. If you're reading the question, you're doing it wrong. B, C, and D are all new patient. Answer A is established. If you know for sure your patient is established, then A could be your answer and you could pick it and move on. Of course, the second word in our question does say the patient's new, so now we can just eliminate that one and make it to where we've got a 75% chance of getting this one right now. You can either try to do it by your level of visit. Are we low? Are we minimal, low, or moderate with the E&M? And you can also do it with time. Or you can do the differences in your diagnosis code, which might just end up only getting you to B and C anyway. So it might be a waste to do the ICD-10. But if you have MDM and time, then you just need to match the correct time or MDM with the correct level of visit, which can be found at those E&M codes. I don't believe so, Leanne. That would be nice. I would love a drawing tool on the exam. That would be fire, but you pretty much have to do this in your head. That's why practicing these questions is super helpful. B, it was D. Did you check your time? Let's see, and it says low level. Low level is your 203, always. Your minimal to none is your 202. It's hard to do in your head, but if you practice enough, you got it. D is a new patient. C and B are ER codes. And what's 88? What kind of code is that? What's our header for 288? That's our NOS, other, EMS, ALS, advanced life support. Deb, thanks for the follow. Thanks for sharing the live. Are we under the header of EMS? Are we in the ER? Or was this patient a new patient? What's our patient's status? Where are they? And if you have to utilize a parent as a historian, on that lovely chart on page 8 and 9 or 9 and 10, what does that make our MDM? Are we low or high complexity? High is B, C is low. Martha says C. C is correct. Good job. What are Category 3 codes? Where do you find that definition? We've got 2 answers that start with the word temporary and 2 answers that start off with the word codes. In the front of your CPT book, in the instructions on how to use the CPT book, right after it goes through the instructions, it also tells you what type of codes are in the book, and that's where you find your description for Category 3 codes. Denise? B. Meek got that one right. Temporary codes used for emergency technology, services, and procedures. Probably just got them confused with Category 2 codes. When coding anemia and malignancy, ooh, I told y'all about that guideline. They definitely gonna ask you on the exam about this in one way or another. In what order would the ICD-10 happen when the patient is in the office to treat the anemia only? Do we never code anemia with malignancy? No, we know that's a fallacy. Gotta code it. We use a code that will cover both anemia and malignancy. Malignancy code goes first, or the anemia code goes first. These two are most alike in question and answers, right? C and D. So you know your answer is just between those two. You've got a 50-50 shot. What do you think it is? Malignancy goes first. Always. When the anemia, you gotta make sure you double check. And get those written out. You got it wrong? Great. That's an opportunity to learn. Write it on that ICD-10 book, right in the very front of Chapter 2 where the cancer codes are starting, and write that answer down. Patient here for anemia only. Malignancy goes first. What's your header for 99233? Subsequent hospital visit. Our header for 99239 is discharge. Our header for 99234 is observation. And our header for 99238, I believe, is also discharge. So we've got two discharge codes, B and D. It's probably a difference between those two. But check your patient's status. It does say they were discharged. We do have a time, so all you have to do is verify your time and then pick your answer. Are we a 239 or a 238 based off the time given? Ugh, I hate bucks because it's too many fill in the blank. When our CPC exam is multiple choice, I like to practice what I'm going to be tested on. I think it's more efficient. It's the only reason. I mean, they got some multiple choice, but not enough. I've got practice exam questions on my website that are all multiple choice, if you ever want to play around with those. I have a free practice area and a membership one too. We've got two answers that are new patient, one established, and one consultation one. If you can't do the headers as fast as I'm doing them and know them like this, I do have 3 flashcard games that you can play on my website that are free that will show you a number, and then you got to guess which header it is. It's multiple choice, but still. Doing those over and over again will help you develop the skills of knowing the headers for each one of your E&M questions. That will speed up your exam taking attempt too and your accuracy. What is our patient status? Are they new? Are they established? Are they here for a consult? What matches MDM or time-wise with what we've got going on with patient status? You're very welcome. User, thanks for the follow. Oh no, you can't find it for cheap? Let me see. I do have people selling them inside my study group from time to time too. I have some people give them away. Amazon has one with free shipping for $79. Walmart, somebody on Walmart has a 2022 version of it for sale for $42.86. It's used. That's fine. I know the E&M guidelines won't be 100% good, but it's good enough. And the rest of the manual, everything from the beginning, the business of medicine, the anatomy in it, the guidelines that are in it, you need the rest of the book. There's going to be a few E&M updates that you're going to need, but that $42 one on Walmart is just fine. Yeah, that's the cheapest one I see. eBay, somebody has one for $99. Ugh, that's not nice. Book Run has one for $21.79 used with free shipping, and it's a 2023 version. Nice. There's one on eBay for $63.63, but everytext.com has one for $27.97, and it's a 2022. Abe Books, ABE Books.com has one for $63.28, and it's a 2023 version. That's a good one because the E&M codes are up to date in the 2023 one. What did you guys think the answer is for this one? I got D, A, and B. Oh my gosh, everywhere. A former patient of a urology group. What? Complaints of urination after not being seen in the office for 4 years. So, why they tell you that they're considered new patient? And then we did comprehensive, and we did 50 minutes. So are they A? No, they're not Medicare. And new patients, their timeline is way on up there. It's got to be like 75 minutes or something like that for them to get. And you can't use any prolonged service codes with any other codes other than 205 or 215. 204 will never ever get a prolonged code added onto it, ever, or a 214, ever. Nope, nope, nope. And we got a lot of minutes. 60 minutes. 205 has to have 60 minutes. So this one's just going to be a 204, right? Yep. Sweet Peach, thanks for the follow. Which of the following CPT codes is Modifier 51 exempt? Do you know where you should be running right now when you see that? There's an appendix in the back of the book, and if you run to it, it's a lot faster than going to the 3,000s, then the 4,000s, then the 6,000s, and the 5,000s, and looking up those codes individually. What appendix am I talking about? If you run to it, you'll get a numerical ordered list of every code that is 51 modifier exempt. And you just look at the codes on that page in numerical order, and you can find the one that is matches, right? Super fast. Super fast. So the 3 books I need is AMA CPT, ICD-10, study guide, and you need a HCPCS book. If you're going to do AAPC, you need to have their versions of the ICD-10 and the HCPCS. And the HCPCS. And then their little study guide, like mine's still from 2019. It's still got the same practice exam questions in it that the 2023 version had in it, except for some of the E&M questions updated. But all these are all the same. But it still is an excellent book. It's their course. It's the same exact thing that's in their course, but in a workbook situation. And it's got more info in it than you could ever possibly learn. It's good. Step 1, business of medicine. What's inside each one of those Medicare entities and what's covered inside each one of them. There's your first 2 questions on your certification exam right there. What are NCCI edits is your next question on your exam, which is right here. Fraud and abuse. Third question on the exam. This is an example of fraud. This is an example of abuse. OIG work plan. That's your fourth question on the exam. That gets you through chapter 1, and that chapter 1 hasn't changed in decades. Then your next chapter. Where's a Warthan's tumor? What attaches bone to bone? What's that little white dome area called in your nail? That's your next question. What's a skin irritation? Trick, right? And then the flow of the heart. When the oxygen goes out, the blood goes out to the lungs and comes back into the heart. What's the route? That's your fifth question on the exam. The order, transverse, ascending, and descending. Or is the order duodenum, duodenum, and ileum? Which one and what order are they supposed to be in? That's another question on the exam. So this book does a really good job of showing you the areas you need to study. But you need the study guide. You need an ICD-10, HIT picks, and your CPT book. If you're going to do the CPC exam, if you're going to do CRC, all you need is the ICD-10 book and the CRC study guide, not the CPC one. But you just need those two if you're going to do CRC. But yeah, they've got, I like Abe books. I like Book Run too. They do good everything. I don't know who this everytext.com is, but they got one for $27. This one's Second Cell, $42. It's a 2023. eBay, $63. Book Run, $21.79 for 2023. Shoot. I don't know if they're renting it or what that is, but that's a really good price. Anyway, yep. Good prices. Those will work just fine. C, good job. Observation, discharge, discharge, observation. Where is our patient? And then match up their MDM and time. What's your answer? CRC is preferred by employers. They're really looking to hire CRC people. So it's not that I prefer it, it's just that employers prefer it. I don't like medical coding and I don't like risk adjusting. I like medical auditing, and that's what I do for a living. Well, until the end of May, and then I'm going to be just a teacher on the internet for you guys because I'm retiring and I'm going to stay home and do this all the time. I think I'm going to try. If I can just pay for health insurance, I'll be all right. But I've been in the medical field 30 years as of this May, so I might be able to quit my job. I put in 6 months notice. I don't think they believe me though. We'll see. I need a medical auditor to take over my job. I think they're going to end up hiring a team of people, actually. They're going to need more than one, that's for sure. I do the commercial side of the auditing for my group, but the Medicare side, they have a team of people. But we've got the same amount of population, but they're going to need another team. Aww. Howdy kitty. Billing. what's the difference between CPC and CPB, billing? Do you want to be billing or do you want to be coding? These codes are in the front of your CPT book in the very beginning in the red section in the E&M section, and 2 of them are for discharging a patient and 2 of them are for observation. What year book do you have of the CPT book? And I can tell you what page numbers are on. Page 19 has code A in it. Page 20 has code D in it, and also has C and B in it also. I have a degree. I also have the certificates for CPMA and CEMC and CPC. Well, CPC is medical procedures and diagnosis codes, where CPB is billing based off of edits and government entities, insurance company information. No worries, Rose. What do you guys think the answer is? Where is our patient? Good job. Yes, they are in observation. Modifier. What modifier should be reported when a procedure code for a transurethral resection for a prostate tissue? Yep. It's a planned procedure and is performed by the same physician during the post-op period. 22, 52, 58, or 77. What do you guys think? Thanks for tapping and sharing the live and following. I got 53 new followers tonight. That's crazy. Oh my gosh. I hope I can help you guys out getting into this medical coding career. There's so many opportunities. Even Amazon has a new healthcare program now for like $6.99 a month. You can see physicians unlimited online all you want, and if they do need to see you in person, then they've teamed up with like Walgreens, and you can walk in and see the same person or whatever there for the same price, whatever, it's the $6.99 a month. And then they've tagged on a pharmacy benefit that's $9 a month. Heck, I had to switch my prescriptions over there to them because then I have to go out and pick up anything through a drive-through or whatever. They just ship them to the house. And man, their prices were a lot cheaper too. I like it. But they all need medical coders. You take your exam tomorrow and you're wearing green. Aww. That's awesome. You remember the NCCI edit question, right? You know what to look for? We're going to be looking for the code that has the 1 in the chart so that you can skip the edit and go straight into allowing that code to go through. Warthan's tumor, the OS opening in the cervix. You know what attaches bone to bone. What else do I have? Inferior, superior, flexible, and rigid in that digestive system. It makes a difference whether the scope is flexible or rigid. Make sure you pick the right code for that. Adverse reactions. We know that the 6-digit on the ICD-10 code will be a number 5. Know where that little chart is in integumentary that'll tell you what the answer is if you did a tissue transfer and a punch biopsy, or 2 shave biopsies in 1 punch, something like that. That colorectal chart in the digestive system where it says it's a little mind map that tells you which code to pick if you're diagnostic or therapeutic. Be sure you know where that is. Phalanges, trichomonas, Skene's gland, Luna, Lunula, Warthan's tumor, I said 5,000 times, parts of the shoulder, parts of the knee, ESRD, end-stage renal disease, advanced life support, basic life support. Did you see where those new codes were in the HCPCS book? They're little status alert numbers that tell you where you picked up your patient and where you dropped them off in the ambulance. Do you know where those little numbers are located at? They're not the easiest things to find in this stupid HCPCS book. I need to mark them. I need to put a tabby thing here because they're not easy. Because I keep going to the A's and they're not there for some reason. Because there's like 3 different sets of codes that are in the A's. But here in the HCPCS book, it's DEGHIJNPRSX. It's right before the HCPCS number A0021. And it's about picking up your patient at the scene of an accident and then bringing them to a skilled nursing facility or a hospital. Those little codey things, man. Be sure you know where to find those. Instead of tabbing the sides, you know I don't tab the books at all. But a few things I like to tab the top of the book so I can find the page. That's what I'm going to do for that one. That way I know where that one's at. The other thing that I have tabbed in the HCPCS book, where did I put? Oh, but you may not have this version of the book, is, why did I tab that? No telling. Oh, the general coding, correct coding policies. Not that it does me any good, because they're just a hodgepodge of a nightmare of stuff, but I at least got them tabbed. The other one was the appendix of the 100 references from CMS, but be sure you know where that page is at. Abuse and use, penile prosthetic, a vaginal birth, had a 94 in it, J11, an open compound fracture, strangled hernia for a Blue Cross Blue Shield patient, know what each letter of HIPAA stands for and what each letter of NCCI stands for. They replaced an electrode for a pacemaker, not the pacemaker or the battery, but just an electrode. What code would that be? And if you're doing a short or a long arm cast on a patient, but it was a difference between fiberglass or plaster cast that made the difference in which code you picked out. And somebody in hysterics over a sister passing, and then they have the autopsy with the nervous system included. If you get the difficult exam, those are some of the things that they ask about. But go on and put your books in the car or have them on your desk wherever you're taking the exam tomorrow. Have it all set out so you don't have to think about it for tomorrow. And you gotta email me. Let me know how you did. Let me know if there's anything on it that you didn't. I didn't prepare you for. 58. You did good, Sky. Good job. What about this one? You know it's going to be the 99358 code. Is it by itself? Would you code it with something else? Do you have 3 codes, 2 codes, or 1 code as your answer? Ambulance codes are on page 113. FYI. Thank you, thank you, thank you. Yes, I had that question for last week's discussion class. Awesome. Whoever your teacher is, she's doing a great job then. That's great. I'd never heard of those codes before. But the last coding course that I took was like, 1994? It was a long time ago. Which page am I on? If you're talking about my 2024 HitPix book, I was on page 113. Yep. That was the page. But I don't know if you got that book or not. I just wrote in the 2024 updates on them. Awesome. Yes, you can still use the 2023 exam books or manuals. Yep, you sure can. If you're taking an AAPC certification, if you're taking a AHIMA, I think the last day to use those books is the end of April. I think May 1st, CCS and CCA people have to have 2024 books. But I have a document that will turn your 2023 books into a 2024, but so far no one said anything about any new codes being on the exam. It may not even be needed, but I do have documents that will help you do that if you want to. You already have everything. Don't forget about your driver's license, and don't forget about your AAPC membership ID number. Be sure and have that with you. Great. Perfect. And you got peppermint with you? Some sort of peppermint gum, peppermint tea. Good. Good, good, good. You're going to do great. You're going to do great. Just keep moving, keep moving. Just look up the differences between the answers. And whatever that difference is what you look for in the question. If you have to. A lot of times you can pick out the answer without even having to look. So there's been actual real medical studies in the New England Journal of Medicine. They gave exam takers an exam without peppermint in their mouth. And then they gave them another exam with peppermint in their mouth. And that was the only difference. And the exams that they gave peppermint to the students with overwhelmingly always scored better on those exams than they ever did without it. Apparently, something about the opharynx stimulates, that scent stimulates something. What is it, guys? The pharynx, nepharynx, something in the brain. It makes you more alert of some sort. I don't know, you score better on exams. Isn't that silly? One scent or one taste, something about the smell, I think, stimulated something in the brain. It was something about the scent. So I just tell everybody now just to, and they can put exam people in a blue room and a red room or a green room or a yellow room, and the one or the two rooms that people always score better in is the yellow and green rooms. So I always tell people to wear those colors when you're taking the exam too. So those are just little things that I've read in real medical journals that seem to actually make a difference. It's kind of interesting what your surroundings do for your exam taking skills, and also what scent you have on or are tasting at the time, which is very interesting. B, good job. If a psychiatric procedure is reported with interactive complexity, which factor is not true? So you are looking for an incorrect answer out of one of these differences. The caregiver, maladaptive communication, translator, under 18. What of any of these have you ever heard of in your guidelines? Have you ever had anything pop out to you when reading these guidelines about psychiatric procedures that recommend or don't recommend something you've read here? What do you guys think? I know it's getting late. I've lost about 20 people, so we've got still 45 in. It's 8:10 here right now. I hope all this has been super helpful. Got 55 new followers, 134 diamonds, whatever that is, and almost 3,000 views and 1 subscriber. That's cool. TikTok's over here just telling me all kinds of things. Thanks for tapping. Thanks for sharing. I know you got to get to bed. Your exam is at 9 a.m. I'll be on pins and needles. Message me, email me when you get home. You know, it's just medicalcodingbyjen@gmail.com. Let me know how it went. Best of luck tomorrow. Try the process of elimination, looking for your similarities. There's a reason why they have 2 answers with the same answer starting out. There's a reason. Gotta be. They just want to know if the modifier can go there or not, or if there's a parenthetical that goes with it. Good luck, good luck, good luck. Get some good rest. Don't worry, I'll be there with you tomorrow. Crafty Creations. I know you've been around a while too, listening to my lives. Good to see you. What do you guys think is the answer? Anybody want to guess? Caregiver emotions interfere. Communication needs to be managed. Translator needs to be involved. Or underage need a legal guardian in a room. Which one is not true? It's interactive complexity. You know, if my mom was upset and I'm doing a psychiatric procedure, I'm sure that that would affect my ability, right? So it's the 18 thing that is not true. When psychiatric procedures need to be done, a lot of times you don't need a legal guardian with you in the room, which is not true, right? You were looking for an incorrect answer. So it's really hard with these questions to find something that is incorrect when you're used to looking for something that's correct all the time. It's really rough. It's hard. I hate those kind of questions. If a patient presents with pain related to cancer, how is it diagnosed? Again, another area inside my ICD-10 book where I go straight to these codes and I have this whole thing filled up with all the different examples. How is it coded with cancer? How is it coded with, intermittent pain or chronic pain or acute pain? It's all in different scenarios. Get different, which one's coded first, which one's coded second. So they're all there. I wrote them all in. That way I just run to that G89 and go pick up my answer. Good job. Good job. Perfect. That'll definitely be on the exam one way or another. They may not ask you about the guidelines specifically, but they'll ask you a question about a patient who has cancer and they're being seen today for their pain that's unmanaged. Something like that. And you just got to pick out the answer with the right diagnosis code. And we know that these are all skilled nursing. ICD-10, are we an I-25 or an I-20? First, figure that out. What's the differences between the I-20 and I-25? You don't have to go down to the individual little numbers, but just knowing those two things is super helpful. We have a patient who's got chest pain and is diagnosed with atherosclerosis of the heart with coronary artery unstable angina. I got all the examples of any kind of heart condition around these I-20s and I-25s for every practice example that I could find rewritten near these codes. That way, no matter what example I face on an exam, I've got the exact thing written already down. Now just find the right one, pick out the right answer. Hey lady, I'm going to schedule my exam pretty soon. I want to practice this for a while first. Awesome, Crafty. No creations, no worries. We'll be back tomorrow night here on TikTok, and we'll do this again tomorrow night. What do you think is the answer for this one? Good job, Martha. I know it's getting late. It's okay. It's a bonus one for tonight. I was just here working away. I'm building some new anesthesia section on my website. And I thought, I could go live right now. Let's see. Oh yeah, this is the new anesthesia section area on my site. I'm putting in all these new practice exam questions, so it's too fun. But then I got distracted by you guys. Hey Rosemary, thanks for the follow. B, it's the one answer with 6 digits too. You notice all the other answers either have 4 or 5 digits. B is the only one with 6, and you want to be as most specific as you can. I see those things. I don't know if it's my autistic or whatever brain, but I audit that kind of stuff all the time, and I can see patterns in correct answers just simply by the amount of digits they have in the answer too. Anyway, what about this one? We got to match moderate. So no matter where these codes are at, if their MDM is not moderate, it's not going to be the right answer, right? So, what do you guys think? What's the answer for this one? Good night. We'll see you tomorrow. Nicole says it is C. Good job. Perfect. This one, 35 minutes, right? We've got to find an E&M code that matches 35 minutes at least, right? We have to meet or exceed. Which one would match that? Can you find these codes? A lot of them are out of sequence because other codes get in the way. It's nice when they're all in numerical order, but sometimes they get all pushed all kinds of places. X, thanks for the follow. We've got 3 answers, A, B, and D, that are 993. C is our only one that has a 994 code. Another pattern I see. What do you guys think is the answer for this one? Midwest, thank you for the tiny diny. Crystal, thank you for the TikTok. And the lightning bolt. Oh my gosh. You guys are great. Midwest, what is that? The butterfly? That's awesome. That's really pretty. Thank you guys. I like giving away the tiny dinies too. They're fun. And the lightning bolts because they remind me of Harry Potter. I like listening to his audiobooks all the time. B again. Good job. We're going to have to skip this one. It's not formatted right. Alright. This one, they're all under the same 993. 2 of them are in the 0405 area. That's probably a different header than the 15 and the 16. What are the 2 headers? I bet that will help you get to a 50-50 shot if you knew those headers. Then match your time, right? Sherry, thanks for the follow. Even if you don't know anything about medical coding, you can run to these codes and look at the header. The blue and red big font that's above these codes, probably new or established patient, since they keep saying that this patient is initial. They keep reiterating it, so stick with the new patient, skilled nursing, And then just verify the time. They all have a time listed next to them. What do you think the answer is? We've got C. Good job. Perfect. Diagnosis codes. We've got two answers that start off with the A30. I would run to A30. I wouldn't stop at the 1 or the 5, but I would look at the A30, see if we're in the right area, right? If I'm not, then I might go to the backwards to the 27 or the 19. But what do you guys think is your diagnosis code? If you're doing CPC, you're only going to have 5 questions on CPC and only 3 questions on the HIPICS book. Most of your questions will be from the CPT book. Some of your guideline questions might be in the form of a diagnosis code, but they're actually guideline questions and not really diagnosis code ones, but they might appear to be diagnosis ones. Jenny, thanks for the follow. Sarah, thanks for the follow. Oh, share. She shared the live. Thank you. What do you guys think? Are we in the 30s? If we are, we might need to know our differences between our 0.1 and our 0.5. What do you guys think is the answer? Nicole says B. She likes the oddball, 27. Rainey says C, 5. Let's see. Good job. Perfect. There's usually a reason why they have the answers the same. There's a difference between the 0.1 and the 0.5 that they were trying to test you on to see if you knew the differences. So when they do make the answers very similar, try to hyper-focus on those. We've got 3 answers that start off with the word an object and object. B and C start off with the 2 that say an object and objects. This one's an external part, and then this says any. So B and C would be what I would mostly pay attention to first off. But what's our line for foreign body? Does it matter whether it's intentional or unintentional? Is there a guideline about that? Or is it just any small, oops, thing, sorry, I didn't mean to click on it. Or is it any internal organ or whatever, or any external body part? That's what I was trying to say. But they do have a definition as a foreign body that needs to be unintentional. So whenever you're doing this question on the exam, if you see foreign body, you should have written out somewhere in your book to say the word unintentional. Foreign body equals unintentional, and that's it. The rest of it you won't need. Which of the following is not a 7th character for O, which is your pregnancy codes, and can be assigned for chapter 15 of the ICD-10 book? Is it a single gestation, insufficient determine of the fetus, and it's not possible to classify it, or clarification? Interesting. For detecting diabetes, or for fetus affected by a disease? B and D seem like they're going the same route for some reason. We're looking for an incorrect answer, though, which is one of the harder things to find. which would be better way to go for schooling in B and C? I don't know what B and C means. And how long is the education? I would not go to school. I would self-study by just getting the manuals, which is the HCPCS, the ICD-10, and the CPT book. I would purchase a study guide from AAPC and the certificate of which I was trying to do, and the practice exam questions, and self-study. If you're bound and determined to do a course, then you need to do one that is done by the certification entity you want to pass, I guess. Just note that the course is not intended for you to help you pass your certification exam. They are not designed to do anything towards helping you pass your certification exam. There's two separate entities. I teach from the certification exam point of view on how to pass the certification exam. I'm probably the only one that does that. Any of those courses are going to teach you how to medical code, but you won't be able to put that knowledge towards trying to pass your certification exam, because that's something totally different. My job said it was to be certified. Billing and coding. Oh, okay. Yep. Well, AAPC, you don't have to have any prerequisites or courses to become certified in billing or coding. So, they do offer the courses, but you don't have to have it. Which one of the following is not what the seventh character 0 stands for? Anybody know? The 0 does, the seventh character is where you put how many babies there are. 1, 2, 3, 4, 5, 6. Does that help you answer this question? Which answer would be correct? If you wanted to do like an overview or a crash course in something, find you some workshops or something that's cheaper than a whole $3,000 course. See, it ain't got nothing to do with diabetes, right? All these other ones were dealing with how many babies, right? Or live fetuses there were. So that's why C is the answer. Do we have diagnosis codes or one diagnosis when we're reporting anemia due to malignant neoplasm? So there's some place called integrity coding. She does like $25 classes or something, and she's pretty tough. She hires a bunch of teachers. I don't know all about all those, but the lady that owns the company, I attended one of her courses one time just to see what it was and see how well of a teacher she was. And she'll put you on blast. all join on Zoom, and she'll teach a measure. Then she'll call on you to answer a question. And plus she gives out an exam and makes you answer the exam and submit her the exam back to her. And then she'll give you the answers to the exam. So she's pretty tough. And for $25 or whatever, that's a good course. That's a good, crash thing for a price. Many people charge like $125, and I think that's too much. But I kind of like her. So if you had to have a class. You like her, Angel? Is she okay? I don't know about any of her other teachers that she hires, but I've attended one of her 2-day courses or something. I didn't go back for the second one, but I was just curious, and before I recommend somebody, of course I want to sit in and see what it's all about. And I thought she was cool. She was good. She's all right. Yeah. Good. I'm glad. That's awesome. What do you guys think the answer is for this one? She's way more formal and technical in her words than I am. She's probably a trained teacher. I'm not a trained teacher, I've trained physicians and nursing staff, but not like I have a formal education in education. I taught my second child from first grade all the way up to junior high. Oof, that was a long homeschooling. But if I couldn't figure out the answer, we just Googled it. We tried to figure it out. Answer is A. Good job. I'm taking school right now for medical coding and billing, and I'm about to go into your externship. Awesome, Jeff. That's great. So glad you found an externship place. Did you go through a community college or through AAPC externship? Just curious. I used to allow externs in my medical practice, and I had 4 clinics I managed, and I loved externs. But I know a lot of people won't give them the time of day, but I loved it. But I used externs through a community college. It's a school here in Austin called College of Healthcare Profession. Okay, cool. Awesome. I've got a uncle and an aunt that live in Texas. Which instance would be correct for coding C80.0? We've got 2 answers that start off with the first word, when and when, when a patient. Our differences are has not technically or chart states has. That's interesting. Yes, this is micro. Miss Micro Mini. Indeed. I love Pocket Prep. I've been using them for a couple of years now. And they do a really good job. If there's ever any issues with any of their questions, I just email them. Now they've got a bank of 750 practice exam questions for this exam in it, with rationale and answers and page numbers where the answers are. And for $13, you can't beat that price. Nowhere. It's awesome. I've got a link on my website too at medicalcodingbyjen.com. If you come to my website, there's a little pink thing that will fly by. It'll fly by here in a second. And it's their logo. There it goes. It's super cool. They do a good job. You're at the practice area, Jeff? Awesome. You're waiting for your exam on April 30th. Wish you luck. Awesome, Micro Mini. Oh, my website. Hold on, I made a mess out of showing it off. Let's see. Yep. medicalcodingbyjen.com. And this is what it looks like. And I have, of course, additional educators up at the top if you need it. I have social media links. Our Discord study group is underneath the social media tab. Hold on. I don't know if my page is updating. There we go. There we go. And this is where you find all the YouTube. This is the link right here for the study group. So if you want to join the Discord study group, it's right there. This is my hours and when I go live for free. I try to do 4 nights a week. Underneath the resources tab, I have the CPT book prep videos and pages where you can just click on each picture. It'll tell you what to do and you can prep your book. Underneath the FAQs is a really good page. The third sentence down, it says the best list of free resources. This is where you can go find free certifications through CMS right here on this page. You can click there and they have free courses on Medicare. Here's the one for ICD-10 coding, and you can get a certification free from CMS. Procedure coding, they got one for PCS now. The fraud and abuse one is the one that I have to do annually for my job. But they're about an hour-long courses, and you can take the exam over and over again until you pass. And you actually can add those to your resume if you wanted to, just in case. There's a free scholarship at AAPC site. I have the link there, and a free grant from Pocket Prep too if you wanted it. And the free monthly magazines with the questions and rationale from AAPC. The link is there too. Super helpful. I do have a workshop coming up on May 20th. I have a blog here that's totally free. And yesterday I released one that is all about the elements of MDM. Super cool. It's free. The free practice area is practice exam questions. You can just click on the answer and it'll give you the rationale. I do have a paid bonus area that if you wanted to, you could get extra bonus practice exam questions. Like the E&M one is pretty extensive. Plus it comes with extra PDFs you can download. But that's all the practice exam questions for E&M, all on one page. It's pretty cool. I got one for cardiovascular and integumentary too. And the shared gallery is free too. But there's just whatever you could want there on the website. Hopefully it's super helpful for you. And the Pocket Prep thing is that pink thing that went by. And if you click on it and you do purchase the Pocket Prep questions, all you do is come here to Pocket Prep and click on Medical. And the very top one is AAPC CPC exam questions. And they do have 750. And they do have a pass guarantee that if you don't pass, they'll give you another 3 months free. If you do purchase the 3 months access for $40, and they'll give you another 3 months free. And it's pretty cool because you can build your own exams and then you can take them with you and you can do them on your phone or on your desktop. And I like having the page numbers so that you can find the answers. It kind of trains you how to look for the correct answers in the correct spots. So if we pick an answer and you don't know why you got it wrong, you can see here, it'll tell you in the book where the answer is down here at the bottom. Like in the 2024 CPT book, the answer for this question is actually on page 45. In the CPT book, when they're talking about correct coding for this particular patient, I guess. Interesting. our ICD-10 page would be the 2024 AAPC version of the ICD-10 book. They've got page 484 listed as far as finding your guideline and stuff. So I like that part of it. It does train you what to look for and that kind of stuff, where things would be in the books. Pretty cool. Plus, you can quit the exam and build your own exam. Right now, we're doing one that is all guidelines and E&M questions. Don't read your answers or the questions first. Sorry, don't read the questions. Go straight to the answers. Look up your headers for all your E&M questions. That means answer A is established patient, answer B is new patient, C is new patient, and then D is a nurse visit. I just need to do this question and see if my patient is new or established. And it does say they're established. Great. Then I just need to know, are they here for a nurse visit only, or did they see a physician? So if they saw a physician, great. I pick my only code that has to deal with them seeing a physician that's established, because I know these two are for new patients. This one's a nurse-only visit, so I know my only answer it could be is A. It's a lot better to do your certification exam without reading the questions at all, because you're going to end up with brain fatigue with 100 questions, and you got to do them all in 120 seconds per question. If you have to read every single one of those words, then you're going to carry it to the next question and the next question and the next question. It's going to take you forever. With this question, all we needed was this word and that word, and that's it. And we could pick out our answer and move on to our next question. Makes things a lot easier. I don't like none of those. Let's do another E&M. We've got another established patient, another nurse visit, another new patient, and another established patient. The differences between our established is we've got a nurse visit, or we've got a minimal, or we have a low. Those have different times, and they also have different MDMs. What if they don't give you MDM and they don't give you a time? Then you got to go based off your diagnosis. How many problems? How much data did you do? And the risk to the physician. And you as a coder got to figure that out. This one, good job, Court. This is a nurse visit only, because the nurse is the one who's testing the urine, right? Told her they're all cleared up and ready to go. Straight nurse visit. No physician saw the patient. You don't see the name physician at all in this question. (99497) and (99498) are for which services? Are those for chronic care, transitional care, counseling, or diabetes? Do we have codes that are just assigned to diabetes? Jana, thanks for the follow. Oh, Barb's. She said, I learned more from you than my actual AAPC course. I know. I hope you didn't pay $3,000 for that course. Oh my goodness. And I like to teach for free. I teach Mondays and Wednesdays on TikTok for 2 hours after work. And then Tuesdays and Thursdays are on YouTube. My boys are in high school now, and they only go to school 4 days a week. They have a late start on Monday, and then no school on Fridays. So I changed my schedule to where I don't work on Fridays either. So that's why I'm not doing the Monday, Wednesday, Friday things anymore. I do them Monday through Thursday. Good night, Kay. Oh, I'm so sorry. Loving me. Oh, I'm so sorry. I wish you'd never had to pay for a course either. Well, no crying over spilt milk, right? We will just be happy that we have a plan, an actionable plan right now, and I'm here to help you. We're going to make a difference. We're going to get you into this better career that's going to make you more money for your family, for your community, and we're just going to move forward. No worries. CRC. What books do I recommend? I recommend AAPC's study guide for CRC. I recommend their practice exam questions for CRC. And I recommend this book. Hold on. My camera died on me again. I recommend the AHIMA Risk Adjustment Documentation and Coding book if you can afford it. The study guide itself that AAPC puts out for CRC is probably good enough. And the practice exam questions that you purchase, those should be around $40. The CRC study guide, I don't know if you can find an older version of it. You might be able to find one cheaper. But I also really like this AMA book. It's got practice exam questions at the end of each chapter that are multiple choice, and they seem like they're the same exact question that they're going to ask you on the CRC exam for sure. So I like this book, but it's expensive. It's another $100. So. Yes, 2022 books you can't use, my love. You're going to have to get a 2023 or a 2024. I'm sorry. You should be able to find some 2023 books fairly cheap. Inside my Discord study group, there's probably somebody that's passed and is ready to pass on their books. We've got a whole room just for people exchanging books and stuff, so maybe you could find some in there. No problem. Happy to help, Brooks. I'll be back tomorrow night, 6:30 Arizona time zone. Right now here in Arizona it is 8:51, so you can adjust your time and know when I'm going to be live. But tomorrow I'll be live after I get off work, so 6:30. So we'll do another 2 hours. I've already done 3 hours tonight. I can't believe it. Practice exam questions, but I'm happy to help. Thank you for the achieving the bracelet goal. You guys are awesome. Crystal, Midwest, Trendsetter, Kelly, Star, Shauna, Claudia, thank you so much. And Kelly subscribed. That's awesome. I'll be back tomorrow night. We'll do some more practice exam questions. Amazon has a 2024 version for $80. Good job. That's awesome. It's perfect. Thanks for the follow, DV. All right, guys. I hope this was helpful. Proud of you guys. And we'll see you tomorrow night. Oh, don't be surprised if I follow you. I love watching y'all's TikToks too. So the people that have hung out the longest, they send me a list of who's hung out the longest and then who were the gifters, and I'll follow everybody. So if you get a request, it really is me. I do like to see everybody's TikToks. See you guys tomorrow. You're very, very welcome. I'll see you tomorrow night. I hope I can help.